Sponsored by Myriad Genetics.
Myriad Genetics' latest survey reveals a major knowledge gap. Most women don't know that dense breast tissue may raise their cancer risk. Joining us to discuss how to bridge this gap and ensure women are equipped with the information they need for early detection are OBGYN Dr. Stitt and breast cancer previvor Ashley. Thank you so much for joining me today. It's great to see you both.
Thank you for having us.
Sure. Okay, Dr. Stitt, let's start with you. Can you explain why breast density is an important factor in assessing breast cancer risk and how it complicates early detection efforts?
Absolutely, and happy Breast Cancer Awareness Month. This is the first day, so certainly a timely discussion today. When we talk about dense breasts, we're talking about not what a patient can feel or see, but really what we see on mammograms. And mammograms are the only way that we have of actually decreasing breast cancer survivability or increasing breast cancer survivability. Women with dense breasts, unfortunately, cancers can be hidden in those dense breasts and the tissues that these women tend to have. So it makes imaging and it makes a radiologist's job a little bit more difficult because the cancers often start in these areas of increased density, and the increased areas of density that are benign also look very similar to the areas that are consistent with cancer. So it just makes the job a little bit more difficult for the radiologist. So from a patient standpoint, it's absolutely imperative to stay on top of those regular breast checks, to make sure that your providers can become more familiar with your breast, to make sure that they're determining if you need to have supplemental or additional screening done, such as MRIs or ultrasounds. Another piece of the puzzle is the family history. Vital piece of information, making sure that these family histories do change. It's not the same as at 25 as it is at 45, but it'll allow us to know those patients that are at the highest risk of developing breast cancer. The genetic testing that can be done if you are at high risk is the MyRisk hereditary cancer test with risk score. It's the test that I utilize because I know that it's the only test that has been clinically validated for women of all ancestries. And so that just gives every woman an opportunity to have the risk that they deserve.
Okay, really important information. Thank you so much, Doctor. And Ashley, based on your experience, how did learning about your breast density impact your approach to screening and prevention?
Learning about my breast density as well as my BRCA2 mutation changed my standard of care. Genetic testing helped me to understand my risk for for breast cancer as well as other cancers, especially given my family history. There were multiple breast cancers on my mother's side. My mother had metastatic breast cancer, and my father is a prostate cancer survivor. The Myriad MyRisk provided insight beyond what I could see or what I could feel. It gave me a peace of mind by providing me a roadmap to monitor and reduce my risk through early initiation to screening, which I began at the age of 21. So in addition to mammograms, I also had breast MRIs and breast ultrasounds, also with lifestyle changes. And finally, it helped me to make the hard decision at the age of 31 to have a preventative double mastectomy to drastically reduce my risk. This information has allowed me to have open, honest, and ongoing conversations with my family and my children so that they too can understand their risk and make informed decisions about their health.
Yes, absolutely. Ashley, thank you for sharing a little bit of your story. And Dr. Stitt, where can we go for more information?
I recommend all patients go to getmyrisk.com to get that individualized assessment, and make sure you're talking to your families during this holiday season about their family history, making sure you're getting it updated.
Thank you for all the information. Great to see you both. Have a wonderful day. Thanks for joining us.
You too. Thank you so much.